Looking at the role for social media tools is important right now because it's something that's exploding in the world around healthcare. For my organization, ECHO Improving Women's Health in Ontario, we're looking at mechanisms that can help bring women's voices into the conversation. This project was a good way to explore how women's voices could start to be part of the conversation around quality. We know women want very much to be part of that conversation, and this was an interesting project to look at how another vehicle for them to become involved. I think the big contribution of this project is actually the toolkit, that this stops each organization from wondering and questioning all on their own and brings the critical mass of knowledge together and allows the industry to do some of that questioning together and provides a platform for those conversations to take place. So I think that that's a very important contribution that this project will make, is just furthering the conversation and helping organizations to get a little bit clearer about their thinking in relation to these tools and these issues. I think the mechanisms under 2.0 really tie back to bringing patient input into the quality agenda. These tools are going to be in place, or these mechanisms are going to be in place, and if healthcare isn't paying attention to them, that's going to be a conversation that's going on around organizations and the system that they probably need to be a part of. And it will be rich for them to become involved with them, with those conversations. The challenge is, how do you do that in an area where there's no SLAC resources? And communications is often an area where there's no SLAC resources in healthcare. So this project helps organizations to understand where they could start and why they should start to be part of the conversation. It's I think, a really important mechanism around hearing patient voice going forward in the quality journey. In terms of how my organization is starting to explore this, I think a couple of pieces of evidence are really critical to us. One is that we know that some populations of users of the system, citizens of our communities, use these tools, and they're often communities that we have difficulty reaching or hearing from. So that evidence has been really helpful to my organization in thinking about why we should become involved. In terms of the projects that we're working with partners on, I'll give you one specific project related to smoking cessation for pregnant or recently pregnant women. This is a group where actually smoking rates are rising in the province of Ontario. And so there's a lot of concern about that, both for lifelong health, but also for improving perinatal outcomes. This project uses online resources, a website called Pregnets, and supported by text messaging to try and support quitting. It's a project where we've now been out talking to women across the province about what is the evidence around quitting, what are the things that have been shown to be supportive, and what would they like to see out of that toolkit of evidence brought to bear. And women have reacted very positively in 3 out of the 4 communities to the idea of text messaging as a support to their ability to quit smoking. So that's just one example. The organization that I work with is also looking at 2.0 as a means of how do we continue to hear women's voices. We have some structured processes for doing that are a little more traditional, and now we're bringing social media tools into that. And frankly, I'm interested to see how that shifts how we do our work of engaging with communities of women across the province. The question of looking to who's leading in this field, I think really the leaders in this field are not within healthcare, and so we are looking at some of the private sector examples, particularly associations and foundations that are disease specific, and how they've brought the use of social media tools into play. In terms of using some of the tools in the future, we have another project that involves trying to reach women around understanding where in the province they can get help in the instances of sexual assault or domestic violence. We're looking at using social media tools to help them understand how the standards of care and the regional nature of those programs functions, particularly as we add the ability for the system to respond to drug-facilitated sexual assault. This is something that young women we expect will be quite interested in, and so that's a vehicle that we're using, or we're looking at using, is the use of social media tools to reach them, tell them about this change in the service available to them, and help them to understand how to effectively access services if they should need them. In terms of taking up the learnings out of this project, I think all healthcare organizations are going to have to look at social media as a component of their communications plan. Whether they want to or not, those conversations are going on around them, and as we would with any other type of conversation related to our organizations, it's important for us to know what's being said and how it's being responded to in the communities that we serve. So I think we're going to have to pay attention to it. I think the big challenge in this project was to say to organizations, and these are important conversations to inform your quality improvement activities. That's the piece we're really interested in seeing pursued, is bringing that patient voice more to the fore in quality improvement. And I think the tools in the toolkit will really help move that conversation forward. That's going to be a harder conversation. We want quality to be defined a lot of times by the experts, but what we're hearing from women across the province is they have important perspectives on what quality means to them. That's a little bit different than how the experts in the system define quality. So we hope that this project will help bring those conversation elements to the fore. The ability, I'll give you a specific example, the ability for patients to have their own information about what's going on with them would be one example of where patients are saying, or women are saying, they want some changes in the system. These kinds of tools will help to bring that voice forward, whether it's around access to information, whether it's around responsiveness to appointments. There's all kinds of things that we don't necessarily think of as quality that when people are trying to use the system really impact on their ability to see it as a high quality system. If the social media tools can help us to articulate what kind of quality of experience patients want from the system, that'll be a big benefit to the understanding of quality going forward.